slightly away from diving, still on the subject, but a little bit more toward travel, health and diving. Has anyone done any traveling recently? Okay. And where did you go to?
Thailand.
Thailand, okay. And before you left, did you seek any medical advice? Or see a travel doctor or a travel nurse?
No.
Okay. Okay, insurance is always good. Okay, so the Oxford Dictionary defines travel as to make a journey, typically of some length. Wikipedia defines travel as the movement of people between relatively distant geographical locations. This can involve travel by airplane, bicycle, boat, train, automobile, or any other means, with or without luggage, and can be a one-way or round trip. The origin of the word travel originates from an old French word called travail, which means a painful or laborious effort, or labour pains. Both words share an even more ancient root, a Roman instrument of torture called the trapalium. In Latin, this means 3 stakes, as in to impale, similar to the action said to kill vampires in popular fiction. The link between these words reflects the extreme difficulty of travel in ancient times. Fortunately, travel has become much easier, and these associations need not exist. Today I hope to provide a few practical tips for healthy, safe travel and some information on how Dan can assist in this regard. So according to the Dan SA database, the top 5 international destinations for Dan members are Egypt, Mozambique, Zanzibar, Thailand, and Mexico. Remote locations are also increasing in popularity. These include locations such as Micronesia, Indonesia, and Bali. So what are some of the risks associated with travel to these destinations? In Egypt, the traveller risks exposure to vaccine-preventable diseases such as hepatitis, typhoid, and rabies. Non-vaccine preventable infections such as African tick bite fever and dengue fever exist. Egypt is also associated with high rates of traveller's diarrhea, and personal security may be an issue. In Mozambique, the traveller risks exposure to vaccine-preventable infections such as hepatitis and typhoid. Non-vaccine preventable infections include African sleeping sickness, chikungunya virus, African tick bite fever, dengue fever, and malaria. Also associated with high rates of traveller's diarrhea, and personal security may be an issue. The risk associated with travel to Zanzibar is largely the same as when travelling to Mozambique. In Thailand, which you just went to, the traveller risks exposure to vaccine-preventable infections such as hepatitis, Japanese encephalitis, typhoid, and rabies. Non-vaccine preventable infections include chikungunya virus, dengue fever, and malaria. Also associated with high rates of traveller's diarrhea, and personal security may be an issue. Finally, in Mexico, one of the top 5 Dan places to visit. The traveller risks exposure to vaccine infections in preventable diseases such as hepatitis, typhoid, rabies, and cholera. Non-vaccine preventable infections include American sleeping sickness, dengue fever, and malaria. Also associated with high rates of traveller's diarrhea, and personal security may be an issue. As you can see, destination influences risk. And the risk of illness or adverse outcomes when travelling is also influenced by the traveller's anticipated activities. So are you planning on lying on a beach, sipping cocktails, reading a book, and getting a bit of a tan? Or do you plan to partake in adventure activities such as scuba diving or skydiving, maybe even both? The plan of travel, are you going to a rural or urban area, and what mode of transport are you using? The baseline medical condition of the traveller. Is there any underlying medical illnesses present? Perhaps undiagnosed cardiovascular disease. We spoke about the increased risk in middle age, males particularly earlier. And are there any potential exposures during travel? Is there a risk of malaria or other travel-associated infections at the destination? Any travel-related illness or injuries has fitness to dive repercussions. A healthy traveller equals a healthy diver. And at Dan, we'd like you to start the journey well, stay healthy till you reach the dive destination, and return home healthy. Consideration of a few simple steps, or what I will call the 7 I's, can go a long way in preventing some travel-related health problems. Factors to consider include infections or immunizations, insects, ingestion, indiscretion, injuries, immersion, and insurance. So I think we all know what immunization is. That's the process where we receive a vaccine, either orally or an injection, and this stimulates our body's immune response, and we are made resistant or immune to a specific infectious disease. A French novelist likened vaccination to first love and said, "First love is a kind of vaccination which saves a man from catching the complaint a second time." I hope you haven't had that experience with first love. For travellers, vaccines can be divided into 3 categories. Routine vaccines. This encompasses the extended program of immunization which we receive in South Africa and the required boosters. Secondly, those vaccines required for travel, such as the yellow fever vaccine, which is a compulsory requirement for entry into certain countries. And thirdly, recommended vaccines, based on the risk of exposure to vaccine-preventable infections such as hepatitis A or typhoid. So a number of different travel vaccines are available, and choosing the right vaccine for your destination is best done in consultation with a specialized travel clinic or a healthcare provider who is suitably qualified in travel medicine. Insects. So if you think you're small or insignificant, or too small or insignificant to have an impact, try going to bed with a mosquito. Mosquitoes and malaria, however, are not the only concern when traveling. Insects are capable of spreading a number of different diseases. Mosquitoes act as vectors for malaria, yellow fever, dengue fever, Japanese encephalitis, and West Nile virus. Other insect vectors include ticks, sandflies, tsetse flies, and fleas. Malaria, I'm going to spend a bit of time on malaria because it's quite a big problem and relevant to us, especially with divers going up to Mozambique and Zanzibar and those lovely places. This is a major public health concern globally. The World Health Organization estimates that over 200 million clinical episodes of malaria occurred in 2012. The infection is transmitted by the bite of an infected female Anopheles mosquito. It's caused by a parasite called Plasmodium, and there are 5 different types of this parasite species globally. Prevention of malaria may be thought of in 5 different categories. The first step is awareness. Find out about the risk associated at the destination. Avoiding bites, B, is the second step. Compliance, the third step, involves taking the medication to prevent malaria as prescribed. And if a fever or any other symptoms develop, consult a doctor immediately to allow early detection D, and thus effective treatment, where complications can be minimized. Malaria endemic countries are found worldwide, mostly in tropical and subtropical areas. Travelers are at risk of malaria infections in over 97 countries worldwide, and most of these countries are found in Africa, Asia, and the Americas. Generally, in warmer areas closer to the equator, transmission is more intense, and in these regions, malaria is transmitted year-round. In some regions, transmission is seasonal. So malaria transmission generally occurs after the rainy season and decreases during cold and dry conditions. In many malaria endemic countries, transmission does not occur in all parts of the country. For example, Brazil is considered a malaria endemic country. You can see on this map, which is from the CDC website. But on a more detailed map, you can see that the risk of transmission is greater in the northern parts of Brazil than in the south. Because of the variability, the necessity for malaria prophylaxis can be discussed with a travel doctor prior to departure, and an individual risk assessment will take into account the destination country and a detailed itinerary, including specific cities visited, the types of accommodation, the season and style of travel. South Africa is a good example. We are very fortunate in that malaria is largely restricted to the northeastern fringes of the country, and only tourists travelling to the Kruger National Park or the northern parts of KwaZulu-Natal are likely to be in need of anti-malarial medication. The distribution is illustrated more clearly on this map. The red areas are high-risk areas, and anti-malarial drugs are recommended from September to May for all travellers to these regions. For areas outside the border of South Africa, country-specific information should be sought. When travelling to a malaria endemic area, the best intervention is to avoid mosquito bites. This prevents transmission of other insect-borne infections as well. Insect screens on doors and windows allow ventilation and keep insects outside. Many options of insect repellents are available. They can be purchased in the forms of creams, lotions, or spray. When using, the repellent should be applied directly to any exposed parts of the skin. Like sunscreen, it should be reapplied regularly, especially in hot, humid conditions, where sweating will reduce its effectiveness. Reapply after swimming, and if wearing sunscreen, apply the sunscreen first and the insect repellent second. Bed nets can provide protection and reduce discomfort caused by biting insects. Where possible, use insecticide-treated nets, and if the bed net does not reach the floor, tuck it under the mattress for optimal protection. Wear loose-fitting, light-colored clothes. It's easy for insects to reach skin through tight clothing. If possible, wear long trousers and long sleeves, and don't go barefoot. Malaria mosquitoes are most active after dark, so cover up in the evenings in high-risk regions. Spray clothing with an insecticide or repellent such as permethrin, and if you do this, don't use the product directly on your skin. If you are in a tick-infested area, avoid shorts and skirts, and tuck trousers into socks. Wear closed shoes instead of sandals. It's not very fashionable, but it will stop ticks crawling up your legs or biting your feet. Watch out for peak exposure times and places. Peak biting activity for the mosquito vectors of diseases such as dengue and yellow fever is during daylight hours. The vectors of malaria are more active between dusk and dawn. Focusing preventive actions during peak hours will reduce bite risk. Spatial repellents and insecticides help to clear rooms or circumscribed areas of mosquitoes. The products have synergistic effects in that the aerosol insecticides kill mosquitoes on contact, and the mosquito coils and spatial repellents work to keep mosquitoes away from an area. Coming to anti-malarial drugs, there are three agents of choice: mefloquine, doxycycline, and Malinol or Malarone, and a number of different factors influence choice. For divers in Africa, we generally recommend doxycycline. Malaria is more expensive, and limited data is available on its use in divers. Mefloquine is not recommended at all because of its side effect profile. Neurological side effects can include dizziness, loss of balance, or ringing in one's ears, and these symptoms can be confused with decompression illness. Psychiatric side effects include feeling anxious, mistrustful, depressed, or having hallucinations. Also not a good idea in the dive environment. When used, doxycycline is started 2 days before departure, taken daily, and continued for 4 weeks after return. Malinol requires a daily dose starting 2 days before travel and continuing for 7 days post-travel. Mefloquine is the most user-friendly. It requires a weekly dose, which is very convenient. However, the side effect profile is not at all compatible with diving. Early detection and prompt treatment of malaria can prevent progression to severe disease, which can be fatal. Uncomplicated malaria is characterized by fever and flu-like symptoms, including chills, headaches, muscle aches and pains, and generally feeling unwell. The symptoms can be non-specific and can occur intermittently. Severe malaria is characterized by seizures, mental confusion, kidney failure, acute respiratory distress syndrome, and unconsciousness. The symptoms can develop as early as 7 days after initial exposure to a malaria endemic area and present as late as several months after leaving the area. So should you develop a fever, consult a healthcare practitioner immediately for any signs or symptoms after or during travel. Someone once said that travel broadens the mind and loosens the bowels. A case of traveller's diarrhea can spoil the best planned diving trip. It's an extremely common condition affecting between 40 and 60% of travellers. Mostly it's self-limiting, but can be complicated by severe dehydration. According to UK statistics, the greatest risk is in developing countries. The green areas on the map are those regions that are considered low-risk regions. Less than 4% of travellers to these areas are affected. The orange areas, which include South Africa, are considered an intermediate risk and are associated with diarrhea rates of between 8 and 15%. High-risk areas, mainly in Africa, South America, and Asia, are associated with diarrhea rates of approximately 40%. So almost 1 out of every 2 travellers to these areas will be affected. Avoidance of travellers' diarrhea can best be summed up in the rule: boil it, cook it, peel it, or forget it. If you drink water, buy bottled water, or bring the water to a rolling boil for 1 minute before drinking. Bottled carbonated water or fizzy water is safer than uncarbonated water. Ask for drinks without ice, unless you are absolutely sure that the ice is made from bottled or boiled water. Be careful of water used for brushing teeth. I think we sometimes forget about this. And hot tea and coffee and closed fizzy drinks, beer and wine are usually safe. For cooking, eat foods that have been thoroughly cooked and that are still hot and steaming. Be careful when eating seafood. Avoid raw vegetables and fruits that cannot be peeled. When eating raw fruits or vegetables that can be peeled, peel them yourself, washing your hands with soap first. And don't eat the peelings. Vegetables like lettuce are easily contaminated and are very hard to wash well. These are best avoided. And if you are in doubt about a food or drink item, rather do not consume. Treatment for traveller's diarrhea can be divided into 3 different modalities: fluid replacement, antibiotics, and antimotility agents. Adequate fluid replacement is essential. This is the most important treatment. Most cases of diarrhea are self-limiting, and simple fluid replacement can help and make you feel a lot better. This can be achieved by using oral rehydration solution. For example, includes Rehydrate, which you find in most pharmacies in South Africa. It's prepared by adding the contents of the sachet to boiled or treated water. If you cannot find oral rehydration solution, an emergency alternative is to make up your own using 8 teaspoons of sugar and 1 teaspoon of salt added to 1 liter of safe, drinkable water. Antimotility agents include Imodium. These slow down the motility of the gut and increase fluid absorption, thereby reducing fluid loss and preventing dehydration. Some sources advise that they should only be used in conjunction with an antibiotic. Imodium should definitely not be taken if there is a high fever, blood in the stool, or severe vomiting and dehydration. And it should be stopped immediately if symptoms persist for longer than 48 hours or if symptoms worsen. Antibiotic therapy is warranted in those who develop moderate to severe diarrhea. It's characterized by more than 4 unformed stools daily, fever, and blood, pus, or mucus in the stool. Self-medication involves a prescription for antibiotics given before the trip, to be taken only if diarrhea develops. This is useful for planned activities such as scuba diving or a hiking trip. It's very important to seek medical help if there is a high fever, severe abdominal pain, bloody diarrhea, or no improvement with self-medication. And what's very useful about the 3 treatment modalities is that you can plan before for the dive trip and take all of these agents along should anything happen. And if a does happen on the trip, the fatigue and dehydration associated with travelers' diarrhea can adversely affect divers, and it's best to postpone diving until symptoms have subsided and hydration is normal. If it does occur, stay well hydrated and take extra fluid as tolerated. Also remember that certain medications used to control the nausea, vomiting and diarrhea may have side effects incompatible with diving, such as drowsiness. Studies suggest that travelers engage in more high-risk sexual activity than they would otherwise. However, this depends on the population studied. According to research, those more likely to engage in risky behavior include young travelers under the age of 25 years, military personnel, and expatriates. Symptoms and signs of sexually transmitted infections include dysuria or pain when urinating, purulent drainage, itching, and genital sores. They can be of considerable discomfort to a diver, especially in a tight-fitting wetsuit. Prevention can be considered through a stepwise approach. Abstain, stick to one partner, use barrier methods, and if these fail, consult a doctor for suitable treatments. Statistically, a traveler has a 10 times greater chance of sustaining an injury than contracting an infectious disease. Injuries are one of the leading causes for consulting a doctor, hospitalization, repatriation, and death among travelers. These can either be intentional, such as transport accidents, falls, fires, poisoning, or drowning, or intentional. Intentional injuries include interpersonal violence and self-inflicted violence. There's been a move away from calling these accidents because the general opinion is that these are things that can mostly be prevented, so they shouldn't be called accidents. Instead, it's now defined as unintentional, intentional. So when traveling, it's important to understand the increased risk of sustaining an injury, particularly associated with certain destinations or activities, and to take appropriate measures to avoid injury. There's been a number of airline disasters in the news recently, and questions arise about the safest mode of transport. The risk differs across the different modes of transport. This table is from a study conducted in the UK a few years back in an attempt to quantify the risk associated with different means of travel. It analyzes deaths from different forms of transportation in 3 ways: deaths per billion journeys, deaths per billion hours, and deaths per billion kilometers. While air travel doesn't look very safe on the deaths per billion journeys in this criteria, it's not only safer than riding on a bicycle or motorcycle. On a deaths per distance travelled basis, is definitely the safest form of transportation. A few common sense guidelines can go a long way in preventing injuries from occurring. Most of these are the same rules that are followed at home, such as wear a seatbelt when driving, don't use your cell phone and drive, look right and left before you cross the road, and wear helmets when riding on a bicycle or motorcycle. In certain instances, special precautions should be followed, for example in travelling to low-income or unstable regions. And I've added travel insurance at the bottom because this is an important consideration to take before travelling, especially if you know that you are travelling to a less developed region where there may be access to less desirable medical facilities. Jacques Cousteau was one of the most famous undersea explorers of the 20th century, who said, "From birth, man carries the weight of gravity on his shoulders. He is bolted to earth. But man is only to sink beneath the surface, and he is free." Approximately 3/4 of the Earth's surface is covered in water, and most bodies of water can be used as dive sites. Internationally, there are over 6,000 PADI dive centres, and to date, PADI alone has certified over 15 million divers. And popular recreational dive locations are situated worldwide. The risk associated with immersion can be divided into the risk associated with diving and those risks associated with non-diving activities. Diving-related conditions can broadly be divided into barotrauma and decompression illness. Non-diving related conditions include marine animal injuries, drowning or near drowning, waterborne infections such as schistosomiasis or bilharzia and leptospirosis, and other injuries due to boating accidents or water sports. An example of boating injuries include propeller injuries or sailing injuries, and water sports encompasses activities such as wakeboarding and surfing. Once again, a few common sense guidelines can go a long way in preventing injuries from occurring. Dive conservatively and well within the no decompression limits of your dive table or computer. Be aware of the risk factors for decompression illness, such as repetitive dives, deep diving, and altitude exposure soon after a dive. Stay hydrated and rested, and dive within the limits of your training. For non-diving incidents, the best way to protect oneself is to be aware of the risk associated with any activity. So when swimming, read any posted warning signs about jellyfish or other dangerous marine life in the area. And there are lots of other common sense guidelines which can be followed. Surface intervals before flying can be divided into those required following dives within the no decompression limits and requirements for dives requiring decompression stops. A safe surface interval for dives falling within the no decompression limits is 12 hours following a single no decompression dive and 18 hours following multiple dives per day or multiple days of diving. Dives requiring decompression stops should have a pre-flight surface interval substantially longer than 18 hours. The longer the surface interval, the less the risk for developing decompression sickness. And our last slide for the day is insurance. Travel insurance exists to cover events such as emergencies, evacuations, a trip cancellation, lost or stolen items, and travel delays. However, not all policies provide comprehensive scuba diving coverage. It's very important to note the exclusion criteria or disclaimers when choosing a travel insurance policy. DAN aims to cover this gap. DAN membership includes payment for the cost of hospitalization, medical and hyperbaric treatment, and certain other costs associated with diving-related accidents. DAN also provides a 24/7 in-house hotline covering dive-related queries and emergency medical assistance. The hotline is available to both members and non-members. Different levels of membership exist, and cover is provided according to the respective membership level. Jack mentioned earlier that DAN is not an insurance company and does not sell insurance. Instead, DAN uses a group insurance policy to extend medical cover to its members for specific medical, travel, and diving-related emergencies. There are also companies like Alpha Dive who provide equipment and vehicle cover as well. Members can also provide a notification of travel prior to departure. This allows validation of DAN membership and the opportunity to obtain pre-travel advice or referral to a travel clinic as required. As you can see, DAN membership can provide the diver with peace of mind that he will be more than adequately covered during his trip. And of course, it's not the only option. There are other options available for scuba diving. I think what's most important is to take a critical look at the insurance policy and make sure that all the important things are covered before the trip. Should you wish to find out more about safety, travel and health, you can consult the DAN, the CDC or the UK Travel Doctor websites. Or call the DAN hotline and speak to a medic or doctor, or be referred to a reputable travel or diving medicine practitioner. The DAN website has recently been updated and provides tips for safe travel, staying healthy and some information about malaria, as well as many other useful resources and information. In addition to extensive travel health information, the CDC website has a section providing destination-specific information for both doctors and travellers. Upon selection of the destination, focused travel health information is provided. This shows up some focused information on Micronesia. The UK Travel Doctor website provides information on a number of different travel-related topics. This includes a page on scuba diving. If you do call the hotline, we'll speak to one of our team of highly qualified medics, including Laurel, Jens, I think who's at the back, Corinne and George. And if necessary, you can speak to the doctor on call. So in conclusion, remember the 7 I's when traveling: immunization, insects, indiscretion, injuries, immersion, and insurance. Consult a travel doctor prior to departure or call the DAN hotline. And most importantly, have a trip filled with fun, adventure, and many good memories.